Hi, good evening, all. Welcome again to another informative session, and we are looking forward to have many more of you to join us as we proceed. And today we are very much pleased and, in fact, excited to have two young entrepreneurs in medical cannabis. I think Bombay Hem Company does not need any introduction if we are talking about medical cannabis, and they are leading from the front. And we have Jahan Peston Jamas and Avnish Pandya. Both are the founders of this company. So we have already done several events in medical cannabis, and we have already listened Jahan in previous sessions as well, and Avnish also I think joined us in one session. But today and in future, we thought to have some specific sessions for all of you, so that we can have much more knowledge. And Bombay Ham Company is already doing extensive research work in our country, and they have footprints in some global like network as well. So that will be definitely they will bringing for us, and we all practitioners are looking forward to have many more informative sessions with them in future also on our platform. And we are very much excited to get this much of registrations with a very short notice about this event. And what we will do is every like regular interval of time we will have these kind of sessions with them, so that we can be in continuous touch. So without wasting much time, I know you all are looking forward for a very informative session today. I will hand over the session to Avnish to take it further. And again, thanks all of you for joining. You can post your queries and your questions. Meanwhile, the session will be there, and as soon as the talk will be concluded, we will be taking up your queries as well. So, Amnish, over to you. Thank you.
Thank you so much, Dr. Juneja. Very good evening to all the members of Indian Vedyas, as well as a lot of the people who follow Dr. Juneja generally onto this chat. Today, I think from Bombay Hemp Company's perspective, the way we are looking at it is having a series of these kind of sessions where we can discuss specific topic areas that are related to the multitude of diseases that cannabis can help with. And focusing today, I think we are going to have Jahan, who is head of strategy at Bombay Hemp Company. I'm sure a lot of people already recognize him and his background by now very clearly. And joined by Dr. Juneja, who has been at the foremost of the medical cannabis revolution from a physician perspective. One of the first Indian physicians to be live, to be telecasted live during multiple talk shows on news houses where he was, I think that was his main claim to fame coming on. And from there on, he has taken it forward in so many domains, not only for cannabis, but for a whole range of other Ayurvedic issues as well. So thank you so much, sir, for having us on this platform. Today, our objective is to kind of discuss a lot more in depth around how cannabis can specifically affect in pain. And we are talking about cancer based pain as well as non cancer pain. We're going to be talking about pain from a much broader angle. Dr. Juneja is going to provide us an in depth perspective on the Ayurvedic aspect. And at the same time, sir, if we can start off the presentation, we can straight lead into the specific parts of it as well. Jahan, why don't you carry it forward from here and I'll jump in during my part.
Sure, sure. Would be happy to, Avnish. And very good evening to one and all who are joining us live here today, and of course for the recording of this in the future as well. As a matter of introduction, my name is Jahan Peston Jams. I'm one of the co-founders and the chief strategy officer at BOHECO. To lead into a bit more about what we do at BOHECO and how, from a legal and regulatory standpoint, because cannabis as a topic काफी sensitive है. And when we have to think of it, we have to think of it from a legal framework of how this is being used in a licensed manner and how it is affecting and impacting patients' lives and helping the Irish doctor community in a more progressive fashion. So if we could go ahead, Avnish, I think that would be great. Yeah. Just to give a brief background, in within the Ayush and Ayurveda domain, as Dr. Piyush will cover, Vijaya or Bhanga, that is cannabis leaf, is not classified as a narcotic in India under NDPS Act. It is classified as a Schedule E1 ingredient under the Drugs and Cosmetics Act, ताकि manufacturers and companies like ourselves can use it as an ingredient to make different proprietary and classical Ayurvedic formulations. Different classical ones like modakas, vatis, etc., and also different proprietary ones for sublingual use as well as for topical use case. So Bohico is one of the first companies to get such licenses. हम काफी काम किए हैं with the Directorate of Ayush, the Ministry of Ayush in states like Madhya Pradesh, and other states as well. And within this domain, as per Schedule E1 of Drugs and Cosmetics, bhang, that is the cannabis leaf, can be used as an ingredient with proof of concept studies and the right labeling to make sure that any product that has bhang will always have some type of risk attached. And that is why it is important that doctors like Dr. Juneja as well as the Ayush practitioner community are in a position to prescribe and recommend such products and formulations to their patients for many different indications. As Avnish mentioned, we'll be covering more on the chronic pain based area today, and we'll follow up with future discussions on the same as well. So, Avnish, if you can go forward, that will be great. So, quickly to introduce Bohico as an organization and company, we are India's first and premier medical and industrial cannabis or hemp company. जहाँ पे we have used the cannabis of the Vijaya plant to create proprietary Ayurvedic medicines for topical use case in arthritis pain, in muscle relief, and in skin health, as well as we have sublingual RX or prescription based products for pain management, stress management, for sleep, improvement of mood, improvement of appetite, and many other similar areas. So over last few years, we have worked with doctors like Dr. Juneja and hundreds of other doctors to basically bring this cannabis plant into the mainstream of Ayurveda as an analgesic and as a direct benefit to many different patients, whether you're talking arthritis, whether cancer, whether different MS, fibromyalgia, other indication areas. So, Abhish, you can move ahead, I think, quickly as well. Just to give an understanding, within the cannabis family, there are many different species. From a historical point, there are varieties that are low in THC. THC जो है is a जो नशीली वाली पदार्थ होती है within cannabis is also the same compound जिससे pain relief होता है, जिससे analgesic benefit होता है. So in this, there are two, three different types of species. One of the species, cannabis sativa, जो है, the THC is normally of a lower nature. और यहाँ पे इसकी औद्योगिक और औषधीय जो यूज होती है, the industrial and medical जो यूज होती है within Ayurveda, the medical use is majorly value. And thus, other species जो है is cannabis indica. Now, indica, the reason for the name, नाम का जो कारण है, is because of its history. उसके इतिहास की वजह से है, because the cannabis indica varieties were first found in India, and we have to understand that cannabis as a crop in a plant was first found within the Indian and the Himalayan areas within that plateau, and because of that, all of these varieties and the species have developed within our backyard, and as a result, we can think of it like this: that some of them are high in THC, they will be like sort of a wild tiger from one family, from a family, but the others that are low in THC, where it's lesser THC, but the impact on pain and medicine is more, is like a house cat. So if you have to think of how cannabis's family exists, best way to think is one is a wild tiger, one is a house cat. And I think that is the simplest way to explain how different varieties of cannabis exist. In India, there are many different types. And I think here what I'll do is I will hand over to Dr. Juneja as well as to Avnish also to give you more insight from an Ayurvedic perspective and how cannabis or Vijaya has played a historic and instrumental role.
Right. Thank you, Jahan. I think a very much required session today, which we are doing. And as I think all of you are aware, and you have already being available in all our sessions. So we all know that actually cannabis means Vijaya in Ayurveda, and it is one of the five sacred plant in Atharved. Like we have Chandan, we have uh, jasmine, we have tulsi, we have neem, and we have vijaya. So although four plants are very much popular and we all are aware, but somehow there was some negativity about vijaya and bhang, which luckily now getting diminished. And in Ayurveda, bhang is widely used. There are around 190 plus formulations, classical formulations, which are not that much popular, but yes, some are now gaining popularity, and it has to be purified. We all know as an Ayurveda physician that हमें शुद्ध भांग या शोधित भांग यूज करनी है. एंड जो आयुर्वेद में इसके बारे में बताया गया है, दैट इज लाइक वी कैन बॉयल इट इन द cow milk for 2.5 hours, and then we can wash and dry, and also can process with the ghee, गोघृत. आयुर्वेद में सभी चिकित्सकों को पता है, आयुर्वेद डॉक्टर्स को, कि गोघृत से शोधन काफी सारी औषधियों का, काफी सारे मेडिसिनल प्लांट्स का we are doing, we have done that, and it is scientifically also proven. And we all know that it is nidrakar, and that's why it is one of the best medicine, I will say, in the insomnia cases. And in clinic we can say, we are seeing, and we are using boheco medicines and tinctures and other medicines as well, and people are giving excellent feedback. So thanks you guys for maintaining this kind of quality, because that is very much required. And nidrakara is very very effective. In fact, it's clearly mentioned in our Ayurved Granths. You can see that thousands of years ago, our acharyas have mentioned beautifully, and we are seeing now in clinical practice. Deepan, Ruche, Pachani, all these are like properties of uh, Bhang and Vijaya. And yes, we also need to remember, because वात पित्त कफ में से, वात और कफ का तो डेफिनेटली शमन करता है, बट पित्त को वर्ध करता है. एंड पित्तज प्रकृति में स्पेशली ध्यान रखें, पित्त शामक औषधियों के साथ इसको दें, बिकॉज वहां पर क्योंकि उष्ण वीर्य भी है इसका. सो यू नीड टू अंडरस्टैंड दैट, एंड अकॉर्डिंगली प्लीज ऑलवेज रिमेंबर एंड ऑलवेज हैव इन योर प्रैक्टिस कि उसका थोड़ा सा आपने ध्यान रखना है. And otherwise, sometimes we have seen that it is also like promoting urination, and in urinary disorders also sometimes it is helpful. And again, one of the top three की अगर हम बात करें तो शूलर या एनाल्जेसिक is in top three. Analgesic, Schuler, and insomnia. These are top three, among top three indications right now in our clinic. Pain management is one of the best management which you all can do with cannabis and cannabis medicines. So that is excellent, healing, and that's why today we are talking about pain management. And we have seen that as far as Ayurveda and cannabis is concerned, there are so many research papers available. I think that you are just seeing some screenshots on your screen, which I request Boheco team that maybe after the session you guys can share some links if it is there on your website. What I can suggest is you can upload this on your website and share the link of those websites in the comment box. We can post so that people can at least go to your website and see, and meanwhile they can explore about your website as well. That will be you can just create some public repository, or maybe you can have some close section for doctors also, whatever like you guys can decide. But my suggestion is, if these kind of repositories are there in the website, so it will be good for people to refer and take a detailed information, or maybe reading material kind of stuff for increasing their knowledge. So please do that. I think you people have lots of research papers and documents which people can refer. Right. So we know that as far as I said, so we know that there are so many classical formulations, like it is mentioned. Jayapatra Churn hai, Katukadi Kwath hai, Vijaya Gutika hai, Jaya Vidhi Bati hai, and so many other classical formulations, Lokya Vijaya Bati and all. So all of them are there as far as the classical medicines are concerned. And but the point is, nobody was practicing that extensively. So gradually it got diminished. But now uh, companies are picking up, and we have seen that some companies have also started manufacturing the classical medicines as well. So it will be good, and we need to understand. However, there are some limitations also to the classical medicine which I want to right now clarify on this page only, because there are some confusions and clarifications are required. The problem in with classical, at least some medicines are, in the formula it is mentioned that we have to take Vijaya dried Vijaya leaf powder. So the problem is with the potency. So when we are taking the dried leaf Vijaya powder in a classical medicine, the potency will be a bit less as compared to the tinctures or the extract medicines which we are using. The potency is far better than that. So without like offending any classical knowledge, I don't want to go into that zone. But the point is, as a clinical practitioner, we need to ensure that patients are getting benefited. So then the extract and the tinctures are performing better and sometimes ahead from the classical. But yes, classical medicines have their own importance, so maybe accordingly you people can take it forward. So the entire aspect of cannabis, and many times I get this question that okay, I think lots of questions are coming up, so please hold on your horses, and we will definitely take all these questions after the talk. So see, as far as the and then by the way, you all can post. I don't want to block your thought process, so while we are talking, please keep on posting and like bombarding your questions to us. We will definitely take each one of your question after the talk, right? So I was saying that many times people are asking me, as the doctors also, they're asking why you are saying and how it is possible that this particular plant is working in so many aspects. One side you are talking about insomnia, other side you're talking about pain management. So we have separate medicines for insomnia, we have separate medicines for pain management. How you can say that the same thing is working for both? So my answer is, first you need to understand the endocannabinoid system. And when you understand the endocannabinoid system and the various cannabinoids this particular plant is having, so more than 100 cannabinoids this plant is having, like CBD, THC, CBG, CBN, CBC, all are your on screen right now. And the endocannabinoid system, the ACS system, is there from the brain till the toe in our body. So there are receptors which are there in this ECS, in this endocannabinoid system, and these cannabinoids which are available in the plant, so basically they are binding with those receptors and promoting neurotransmission, neurosecretions, and many other aspects are there which we have seen. And like recent research in COVID was that it is inhibiting the process where the virus is infecting the cells. So you need to understand the endocannabinoid system, which is there in the next slide. And so it's a kind of a lock and key mechanism. You can see that CB1 receptors are more in the upper body, like brain, spinal cord, and all, and CB2 receptors are more in the lower part of our body. So when we take cannabis, so the cannabinoids which are available in the cannabis plant, leaf extract, basically we are using right now in India as a medical cannabis is concerned. So they bind with these receptors and they promote certain kind of secretions and the cell repair and the tissue repair, and that level it is working. So that helps us in the healing, that helps us in getting the particular advantage of healing, and it sometimes act as catalyst as well. Ayurved में इसको योग वाही बताया है, and we have seen that with the Ayurveda treatment, with Ayurveda medicines, when we are infusing cannabis, it is working, the entire treatment is working on a very accelerated pace. The same case which we were able to heal in say 6 7 months or 8 months is getting healed in 3 4 months only. So that kind of results also you can get in your clinic when you add cannabis in your standard treatments of Ayurveda. That is definitely very beneficial for doctors as well as for patients, because in Ayurveda we don't want to make them depend on any medicine. We want them to heal and to cure, and that is the ideology of Ayurveda, which I think all of the Ayurveda doctors will agree with us. So this endocannabinoid system is related with many systems in the body, like our central nervous system, our gastrointestinal system. There are certain hormones regulations are connected with this. Then our immune system, metabolism, muscles. So all these systems, bones, and all are directly or indirectly connected with this endocannabinoid system, which has been discovered. And the CBD, THC, and other cannabinoids which are present in cannabis plants are very much responsible for getting us the healing. And as I said, the neurotransmitters are like getting elevated, and we need to understand. So this particular system is kind of a cell signaling system, and it is very much related to Ayurveda theory of vat. I think all of you are aware about vat. So it is that's why it is mentioned that it is vat shamak, and it is somehow managing or controlling the vat. So that you need to correlate with Ayurveda as far as Ayurveda principle of medicines are concerned. And accordingly you can see that in vat there are around 80 diseases which is mentioned. So basically when you check the vat vyadhis, in almost all the vat vyadhis the cannabis is working very well. So that correlation and that connection you can establish, and accordingly you can understand cannabis. It will be easy for you, and it will be like, the more you will understand, the more you will read about ECS system, will give you better knowledge and better understanding about how you can take it forward. So now I think I will
I'll
just
take it forward.
Yeah,
You
but
want to
I
take
will
it? I'll take it
share
after
one
you. Yeah.
clinical experience, and then maybe you can describe. So this is the topical product, the arthritis pain, and what I need to give you some clinical tips on this. So see, there are two aspects. One, you can prescribe the concentrated oil which they can apply. So basically, this is a local application. You have to apply on the particular area which is affected, and it is leaf extract in hemp seed oil. And so the point is, when you need to understand, see that the effect is when you apply this particular oil on your joints or muscles or whatever. So the direct application is giving very good results. Somehow sometimes we have also infused this particular oil with other ayurveda oils, and people are using in that way as well, and that is also giving us very good results. So as I said, it is sometimes acting as a catalyst as well. So both ways you can use. And but please, in my prescription, in every second prescription I am prescribing this. In fact, I clearly remember you people have one other local application product which is related to the skin, and I had a case of bed sores, and that was not getting relieved by so many doctors. I will in fact present that case study in maybe next session. And it's a remarkable healing. In today yesterday I think the patient attendance order around 8 bottles. They are taking because they are seeing so much of recovery and so much. And by the way, we have infused that into the jatyadi tel. You all know about jatyadi tel. And the healing, when we started with only jatyadi tel, it was very slow. But when we added your the skin oil, the local application oil, we got very good results. And the entire sore, it was on the both sides, and the bones were also visible. But now it is completely healed. I will definitely share that case study as well. So again, thanks for that quality. But I request all the fellow practitioners and doctors, please infuse the oils with other ayurveda oils. You will get an excellent result, at which I can vouch as a clinician, and our patients are getting benefited as well. So maybe Jahan or Avnish, you want to add on to this product, please.
No, I think, sir, you have covered it very well. It's a topical product. Both the seed oil and the leaf extract are known to be anti-inflammatory. In fact, this product is also under clinical trial, has just completed, in fact, a good study at the National Institute of Ayurveda. Soon we will be seeing a published paper with the researcher that conducted this study at NIA. I think we have seen more than significant improvement in patients that were specifically using this product for their condition. We have a quantitative as well as qualitative assessment that we will be very soon presenting in some of our future points as well. So the next product I would quickly like to take everyone through is a product around pain management. This one is specifically taking care of chronic pain, people who are suffering from pain from a much longer time period perspective. What we see patients specifically using this for is from a whole range of diseases, people who've had herniated discs, all the way up to people who have issues recovering from the cancer or have issues recovering from diabetic neuropathy or any such chronic condition. We are also seeing now, the important point to notice is a 10 ml packet here would kind of, even if a patient takes 2 to 3 drops a day, which is what we've seen the average prescription write down, we will see this 10 ml packet work at least between 20 to 25 days easily. And the 30 ml packet, we look at it working at least twice, more than thrice, twice or thrice the total number of days there. So we're looking at close to 40 to 45 days. So as you would see, a lot of the cannabis medicine out there is expensive. Now you have to understand one thing, कि एक चीज इंपॉर्टेंट है उसमें, सी है जो प्रोडक्ट की, वो बहुत एसेंशियल है. अभी जो भांग मार्केट में आ रही है जिससे कि ये सारे ऑयल्स एक्सट्रैक्ट होते हैं, वो बहुत लिमिटेड सप्लाई में है. ग्रेजुअली इन चीजों के दाम भी गिरेंगे और इनकी पोटेंसी भी बढ़ेगी. बट आई थिंक ये जो अर्ली अडॉप्टर्स के लिए है, जो लोग नया नया शुरू कर रहे हैं, उसके लिए ये इंपॉर्टेंट पॉइंट है. ये प्रोडक्ट आई थिंक वी हैव हैड more than 8,000 patients that would have used this product over the period of 2.5 years that we have had this in the market. And we have seen very, very good results with a lot of those patients. We have a lot of them as a repeat customers as well. specifically talking to their doctors about prescribing the Bohico branded product because of the potency. Now one thing, एक चीज हमें ये भी नोटिस करनी है कि मार्केट में बहुत सारे कैनबिस ऑयल्स हैं, बट इसमें हमें हमेशा हमारे डॉक्टर को पूछना है कि सर ये पोटेंट इनफ है कि नहीं, इसमें जो एक्टिव पदार्थ है वो इनफ है कि नहीं। जैसे कि आज जब हम कोई भी अच्छी चीज खाते हैं तो हम उसमें जो एक्टिव पदार्थ होते हैं उसका हमेशा सवाल पूछते हैं, whether it is about green tea or whether it is about capsicum, whether it is about chilies. So why should we leave some of the important medicine like cannabis out of it? ये एक important चीज है सारे डॉक्टर्स के लिए भी जो अपनी पोटेंसी में देखें। Then we'll get into cannabis and chronic pain and how basically globally इसकी क्या स्टडीज हो रही है। बोहिको फिलहाल इंडिया में थोड़े बहुत क्लिनिकल इंडिकेशंस में क्लिनिकल स्टडीज कर रहा है, बट ग्लोबली इस पे और बहुत काम हो चुका है। तो cannabis and chronic pain has been studied in more than 18 randomized controlled trials as well as multiple trials that have shown कि इनका प्लेसिबो से कंपेयर्ड इफेक्ट बहुत ज्यादा है। We have seen cannabis being used in many different forms and shape factors also. Whether it is smoked cannabis, whether it is consumed cannabis, whether it is inhaled cannabis, or whether it is whether it is also kind of given through any other sublingual form. There are studies around neuropathic pain, there are studies around cancer pain, diabetic neuropathy, fibromyalgia, as well as HIV associated sensory neuropathy. We've had studies that are looking at products specifically related to natural cannabinoids as well as synthetic cannabinoids. So basically western markets में they have a reductionist science approach, तो वो अपने प्राइमरी टारगेट्स को देखते हैं और उनके कॉम्बिनेशन के बेसिस पे उन्होंने प्रोडक्ट बनाया है। जैसे कि as we are able to see Sativex, which was a 2.7 mg THC 2.5 mg CBD spray that was present there. This product has been clinically approved for indications in the US as well. There are multiple studies. Jan, you want to talk about some of the studies with Nabiximol and Nabilon as well?
Sure, definitely. I think the important thing to understand is जैसे हम आयुर्वेदा में full spectrum cannabis leaf extract use करते हैं, in the same way there are other pharmaceutical cannabis medicines in the West. One of them called Sativex, as Avnish had mentioned, that have a similar full spectrum. For every 1 mg of THC, you get 1 mg of CBD. Now, this comes there in those countries in a spray type of form, where they take it from the cannabis flower in a pharmaceutical manner. There are now studies, as Avnish had mentioned, ki if you can even go back one slide, Avnish, that will be great. We'll just start from there. That even in cancer-based settings and intractable cancer-related pain, if we are taking the full spectrum of THC and CBD, there have actually been double-blind, randomized, placebo-controlled clinical studies done that compared THC and CBD versus THC versus a non-opioid analgesic endocannabinoid system modulator, as well as the placebo. 177 patients, 60 took full spectrum, 58 took only THC, 59 took placebo. What they saw in the NRS score was in THC CBD full spectrum, there was statistical significance versus the placebo, 1.37 versus 0.69. THC, it shows non-significant change, but still some change. There was some deviation, 1.01 versus 0.69. But twice as many patients who took THC and CBD, the full spectrum, showed reduction more than 30% from baseline NRS, which is a huge reduction, as I'm sure even Dr. Piyush will attest to as well, and is now being seen in modern case studies, reports, and phenomena within the Ayush community in India using similar full spectrum products, whether cancer-based pain settings or whether Abhish, you could go forward to the next slide, even neuropathic pain based settings globally, where there are studies. We'll only focus on two: one Rogue 2005 and one Serpel 2014. These use full spectrum THC and CBD up to 24 sprays for 24 hours for 15 weeks. And what they saw was this was superior to placebo and reduced intensity of pain and also the severity of pain on 11.10 hours. Now, if you could go to the next slide, please, Avnish, that'll be great. Now, similarly, there are also other studies by Berman and Co, as well as the likes of Nurmiko, all the way dating back to 2004, 2007. So this is 15, 20-year-old data and literature that has existed globally. And today, in the Ayurvedic setting, having the approval and support of doctors like Dr. Piyush in the Ministry of Ayush, now we can explore such modes to help our patient communities as well. where, as you can see, it's again superior to placebo in reducing pain score, mean reduction in pain, and this shows that it has shown great effect in neuropathic pain, जहाँ पे the CBD helps for the inflammation and the THC helps as the analgesic, and most importantly also it binds to the CB1 and CB2 receptors to be able to reduce the intensity of pain, as well as plays a very positive role in the endorphin system that actually plays a very key part in the perception of pain. And that is why even from neuropathic pain to cancer-based pain to even arthritis pain, as you can see, there are even global studies on this that have shown, Blake 2006, shown that full spectrum Sativex, THC, CBD in 2.7 mg, THC in 2.5 mg CBD actually has helped a huge deviation from the mean endpoint for different RA patients who are using this treatment. And it shows after 5 weeks of treatment, the indifference interval, whether sleep quality, morning pain at rest, or morning pain on movement, has actually improved. And this is the type of clinical data and information West बना रहे हैं. And that is the irony being कि ये बना रहे हैं हमारे हमारे पौधे से जो हमारे बैकयार्ड में उगा था. And that is what is the most, I would say, ironic thing in this entire thing, that India should be the one, and it's the Ayurvedic practitioners who are the ones who have learned this firsthand, working with patients, but also supplementing it with the global clinical knowledge. कि बाहर भी क्या चल रहा है? Is there any validation of this? That is a key part of this discovery. And if we could move to the next slide as well, even for modern day, I would say, disease treatment areas like fibromyalgia, globally there are randomized control trials. जहाँ पे they have been up to zero point 0.5 mg a day, titrated up to 1 mg a day, where there has been improvement on effect of quality of life, effect on pain scores, effect on different symptomatic relief. And if we can, I think that is sort of a key element of understanding how cannabis in medical settings has worked for the West, and how we are sitting on the same solutions here. But now it is in the doctors and practitioners' hands through such awareness and education to understand in what settings it works, in what is the clinical evidence, and now, most importantly, what are some of the undesired effects, because it is still cannabis, it is still Schedule E1. What are these undesired effects with cannabis that doctors must be precautionary about and have to keep in mind when going forward? So I think here maybe I can also hand over to Dr. Juneja for his thoughts, and maybe Avnish for your thoughts as well. That would be.
Right, right. And I think you correctly mentioned that we need to understand one aspect here is, see, as far as cannabis is concerned, most of the part of the world, they are right now focused on the active ingredients more rather than full spectrum. And in some countries, there are issues for practicing full spectrum. But the point is, in India, we are fortunate enough that through Ayurveda licensing approval, we have the medicines which are already full spectrum. Although there are issues with the quality, there are challenges. We are just limited to leaf right now. We are not supposed to use flower or bud as far as the medicines is concerned, because if we're talking about cancer pain and the acute pain sometimes people have, and they are on the highest opioid analgesics and many other painkillers. So if we have medicines right now, also we are able to manage certain cases as far as the acute cases are concerned. But still, it's always better, and we are right now, all of us, including the industry and all, are in discussion with the government that if at least they can allow medical cannabis for that part of the plant as well. But right now, as far as the leaves are concerned, we have the full spectrum, and no doubt in pain, we have seen a significant reduction in terms of the score. We have seen significant reduction. By the way, there are two aspects of pain management which we need to understand as a practitioner, as a clinician. One is the suppress, like the pain is getting suppressed. The feeling, the pain is there, the cause of the pain is there, but the patient is not feeling the pain. So that is one thing. And the second is the root cause of the pain due to which the particular patient is having the pain. So cannabis helps in both. It's not only just like a painkiller that it is just suppressing the pain or just reducing the feeling of the pain, but it is also healing the root cause sometimes. And along with other medicines which we are using in our prescription and all, we have seen that in fact sometimes standalone cannabis, external and internal, is capable of healing the root cause as well, especially in the neuropathic pain, in fibromyalgias and these kind of pains. We have seen that standalone cannabis treatment is also sometimes beneficial, or maybe you can add one or two Ayurveda medicines, like for example in arthritis, or in some kind of musculoskeletal kind of pains, you can add some Ayurveda 1 or 2 medicines along with cannabis, and you will get very good results. And in fact, the best part is patients are not getting dependent, and after some point of time, they can reduce, or sometimes they are without any medicine and they are fine. So that is the beauty of this particular treatment and this particular herb, which we need to understand. Avnish, can you just okay, let me also do that. I think I can also do. So there are some undesired effects, as Jahan mentioned. So we need to understand, as I said, there are two aspects to understand this. One is definitely the Pitta Prakriti people and the effects which are related to the Pitta Prakop are there, like dry mouth, uh, we have sometimes nausea, vomiting, and that kind of stuff. But otherwise, it's just when actually in this part we need to understand the dosage. Like for example, can you just go to the tincture, any tincture slide, Avnish? We have, I think, tincture slide, the internal one, right? Because I want to, yeah, just this. I think no, just a second. This one. So I think we need to understand here is, as far as these desired effects, I will just come back to that discussion. But prior to that, I want to focus one thing which I missed. See, the dosage is very, very important. If you are doing a correct dosage to a patient, the issues will be very minimum and very less. In fact, this is one of the most safe, it is one of the safest herb. The bottle which you are seeing in your front, if I'm not saying to drink, but if somebody will drink the entire bottle, they will not die of this. So till now, there is no death uh, in which the reason or the cause is cannabis. So there is no death certificate in the world where it is mentioned that it is due to cannabis overdose or cannabis is the cause of the death, as far as the medical usage is concerned. In fact, in recreational also, people are using high THC levels and all, but still, if somebody is abusing it to an extent, I've read somewhere, I think, how many hundreds of pounds if people can have at a one point, at one, in its single ingestion, then only it can be fatal. So which is practically impossible that patient can have that huge quantity of cannabis at a single point of time. So it is one of the safest, but because otherwise you can see so many, again, I don't want to criticize any pathy, but there are so many medicine, in fact, in Ayurveda as well as in other pathies also, which are very critical, and if something will go here and there, patient can be at a fatal stage as well, which in cannabis it's not. But still, the dose is very important. You need to understand, like for example, you have a 10 ml bottle or a 30 ml bottle as per the potency. Like in this slide, you are seeing that we have 15% of leaf extract, and accordingly you need to ensure that the dosage should be as per the body weight, as per the age of the patient. In fact, we can have another session in which we can discuss more in detail about the dosage form, and the dosage as per your various pinches are available.
Correct.
So right now, need to understand that at least start with the minimum dose. Uh, always start with an evening or night dose to a patient, and then switch to the day dose as well, because it will take few days to a particular patient, to their body to adopt this particular herb, and then gradually you can start with the day dose as well. So that is very crucial, and maybe the safest part is you can start with 2 3 drops, 4 drops minimum to start with, and then you can increase the dose accordingly, because it will have some tolerance also gradually. So now, if you managing that dose, still you feel that sometimes patients are asking about dizziness, which is fine. You can just ask them to stay calm. That's why we are giving 1 1.5 hour prior to the bedtime initially, so that in few days they are like adopting this particular herb. Dry mouth, you can ask them to have some fluids and honey, and that kind of aspects can be managed. Nausea, vomiting, not much is there, very few, if they are taking a bit high dose. Fatigue sometimes can be there. Drowsiness is a very common symptom which initially will there, but otherwise it will be diffused accordingly. Then yes, euphoria, and again loss of balance, hallucinations, all these will be with a bit high dose if they are taking. Sometimes they just by error press the dropper more and they take more drops, so that can be there. But if you are giving them the fixed dose, it's not that much as far as and always start with the minimum dose. But yes, sedation can be there, and in fact, sedation is positive for insomnia patients and patients who are not able to sleep well. So it's not a side
Correct.
effect, the healing effect for them. So, but otherwise, I think if you compare with other counterpart medicines and other like options available in all the pathies, this is one of the safest option, I can say, is there. And these are some drug interactions, a very complicated slide right now to be like to read. But again, We can have a
Correct.
separate section in which we can understand more about the drug interactions. There are some drugs which we need to be a bit cautious, as far as some anti-convulsant drugs, some epileptic drugs, some anti-retrovirals are there. We need to understand that, and accordingly. So I don't want to get it diverted from the discussion today, but just to understand, as far as predominantly, if somebody is taking some kind of a painkiller or steroid or that kind of medicine, which generally sometimes initially they are, today we are discussing about pain management. So this is particularly, this is specifically, this is fine, you can give with that kind of drugs, it's safe. But yes, to some drugs it is not, so which we'll be discussing in the forthcoming session. And also you need to understand that you can always have a bit gap also when you are administrating cannabis, so it is always good to have that. Otherwise I don't think so there's an issue. It's almost with all the drugs it's fine. And you can again, if somebody is allergic, that is one thing which you need to understand. Pregnant and breast feeding, definitely we are not recommending, because in studies it has been mentioned that it is going to the placenta as well, and it is very much available in the breast milk of the lactating mothers also. So there are some studies to prove that. So although the data is not available much, so that's why as a clinician we avoid to the pregnant females and the breastfeeding females to not to take the cannabis. And yes, specifically the heart conditions, and in heart conditions also, if you are having the impulsive disorders, the like if you are having pacemakers and that kind of diseases are there, you should discuss with your doctor as well, and the medical cannabis practitioners also should take care. In coronary heart disease and blockages and those kind of disease, it's not that much issue, we are already giving to those kind of patients. But yes, if you have disorders which are related to impulse, and like if somebody is having pacemaker or those kind of disorders, you have to be a bit cautious in those cases. So otherwise, you need to take care. Alcohol definitely should not be the preferred medium, or sometimes you are under the influence of alcohol, please do not take. And under 18, always parental guidance is required. If you are giving to a pediatric age group, as far as some epilepsy or some other issues are there, we have to give that. But under parent guidance, please. Driving, operating any machinery, and all those aspects are, and generally hypotension people are also, we are giving with very precaution, and sometimes it's not recommended to them as well. So there are some general instructions which we need to follow and which we need to understand. But otherwise we have seen it is pretty safe, and it's almost widely being used in many kind of patients, and we are getting in various age groups also, to the senior citizens till the middle or the young age group. Everybody is able to take it and tolerate it, so it is pretty fine with them. So I think we already have so many questions. Anything Jahan and Amnish wants to add to this talk today, they can. Otherwise, we'll start taking questions now. And I request all the audience, please start posting your questions now. Whatever question you want to ask, we already have several questions which we'll be taking up right now. Over to you,
Yeah,
Jahan
I
and
think
Amnish.
so. We can go ahead with the questions and spend more time with everyone who's attending on the questions they
Great.
have.
So, thank you again, all of you, for joining. So, there is one question that heart surgery कराए हुए patients cannabis treatment ले सकते हैं? Yes, Abhishek, Dr. Abhishek, any patient who has heart surgeries can take cannabis, but again, you need to, as we discussed, that for heart conditions, you need to discuss with the particular doctor, and accordingly, if it is fine, and we can take it forward. But otherwise, but as I said, heart surgery किस reason से हुआ है? If it is was some like blockage, some bypass or stent has been done, so इतना issue नहीं है. But हाँ, अगर pacemakers हैं तो वहाँ पर थोड़ा सा आपने ध्यान रखना है. Any feedback, any testimonial, Jahan, Avnish, you have for heart patients or heart surgery cases for your products?
So nothing directly with the patient who's gone through post surgery that way with the heart. John, I don't know anything. If you know something directly, please.
Uh, well, not directly. I think here is there's a lot more relevance for hemp-based foods, which are actually cardioprotectants, and they have sort of relevant actives from a nutrition standpoint, superfood standpoint, that help in recovery for heart patients as well. We have had several patients from some of the doctors we work with who have had sort of cardiac issues or heart-based issues where low dose pain management sublingual formulations have assisted them for symptomatic relief. But again, as Dr. Piyush recommended, it must be at the discretion of the practitioner and would be completely low dose and with a view to titrate dose upwards based on how effect is. We have seen some sort of case reports, but from different doctors, where again it's in at the I would say discretion of the practitioner, basis how the patient medical history is.
Right. So again, thank you, Dr. Amrita, for sharing your feedback that they are effective. In fact, I request all the doctors who want to connect with the Bombay Hem company, please share your details. Already, we have around 100 registrations. So if you have not registered for this event yet, please go to our social media, Facebook page, or my LinkedIn is there, Indian Vadyas, or my personal profile. Anywhere you are connected to us, please check. We have posted this morning about this event, and there is a registration link which you can register, and e-certificate will be shared with all of you on your email id, respective email id, from boheco. And second, they will have your details so they can connect with you and send you samples also. They have complimentary samples for all the practitioners, and gradually their team will be in touch with you to help you and assist you with any further guidance and coordination is required. And roughly, Jahan and Amnish, maybe we have certain queries I can see in my inbox as well. That how doctors can connect with you. Is there any process? Is there any mechanism where they can connect with you? So please, you both can elaborate on that aspect quickly.
Sure, sure. I'll be happy to. I think we're very, very straightforward, very easy to connect with and access with. I'd be happy to also leave our contact information about our numbers as well as email addresses in the chat here, or via Dr. Piyush share it along to any doctors interested. We'd be happy to reach out I think, any time of day or night. We work with and engage with doctors from all across the country, and our contact details are sort of readily available. So, Dr. Piyush, let me know if you'd like me to post it in chat or if you'd like to share it along for
Yes, you can post
the
right
gap.
now because we are being seen live at various platforms. So maybe you can just quickly share. We will show it to the entire community right now who are seeing us live. So as far
Sure.
as diabetes and osteoporosis is concerned, Dr. Neelam, definitely, as I said, as with the Ayurveda treatment, if you include this, it will definitely give you results, because as we have discussed about ECS, and many times it is helping us in healing the beta cells as far as diabetes is concerned. And in osteoporosis also, we have seen a better absorption of certain medicines when we are giving along with cannabis. And in osteoporosis, the pain management is also there, in which it can also help. So yes, definitely it is effective. So we are not saying here that there is no medicine, Dr. Krishna Babu. I think there was some miscommunication maybe from our end. The only thing which we wanted to convey here is, see, as far as Ayurveda is concerned, there are certain other medicines which I agree, and like we always recommend and we always practice those medicines also. But still, as far as medical cannabis is concerned, so the way we have seen the results are there in terms of the efficacy, in terms of the quick action, and in terms of the pain relief is concerned, this can be one of the best solution in the entire range we have as far as pain management is concerned in Ayurveda. So in that note, we need to understand that. So we have just flashed the email id and the contact number of concern people. Jahan and Amnish both is there, so it's jahan.pj@boeco.org and amnish.pandya@boeco.org. So maybe you can connect with them, and accordingly you can take it forward. So let me just quickly go to the next question now. Uh, thank you, Dr. Aditya. He is working very well in oncology. So, can it be tried on COVID patients suffering with joint pain? Yes, definitely. In fact, it will have multi-dimensional healing. On one side, it can help them in managing the COVID. There are couple of research studies, and for joint pains, definitely is one of the best painkiller. So quickly, Jahan and Amnish, you both were there. I think when in April last year we had one session as far as the COVID study which was there about reducing the cytokine storm. And this, last month also there was one study, and I have seen you people have some articles on that as well. So quickly, you can maybe elaborate our audience right now, that in both studies, what was the finding and what you people realized, and maybe any other additional information you want to share?
Yeah, I think from a post-COVID and a COVID-19 recovery point of view, we've seen quite a few patients who have used such sublingual formulations, majorly because of the, I would say, anti-inflammatory response of the CBD and THC when consumed sort of sublingually on the CB1 and 2 receptors, which helps sort of bring down the inflammation and swelling with joint pain. We've seen the same with OA and RA patients as we have with patients who have sort of joint pain from COVID or sort of other areas as well. So you're absolutely right, Dr. Piyush, that there is definitely some potential here, and we have seen sort of patients in use case from doctors who have prescribed this actually have sort of a good effect on them.
Right. So in cramping in leg, yes, we can take. In fact, I recommend to apply the local application oil as well along with the internal.
Yeah.
It will help definitely. So we have one Dr. Neelam from US, and she's just asking that if she can get samples in US. So although US is way ahead as far as the medical cannabis is concerned, but still she has shared her email ID and mobile number. So maybe you people can connect with
We'll
her
take it
and
on. Yeah.
accordingly take it forward. What about wellness medicine? What is the minimum dosage? Can anyone use it as a wellness, as a general health booster? Excellent question, Dr. Namrata. Definitely, it's an excellent solution to maintain wellness. Immunity is the key. I think you people have some, product
Sure, I
regarding
think
the
I would
immunity
like to
aspects.
add to this.
Yeah.
What the overall thing that we have seen with people who have been consuming small doses of cannabis over a long period of time is in its ability to help in maintaining homeostasis, which is one of the most important jobs that our actually body does in balancing out a lot of the different activities amongst our vital organs. The second thing that we are able to see is improvement in gut health, which has actually been very well related with the use of cannabis and bhang based churans in a lot of IBS related issues, a lot of bowel syndrome related issues. We see this. We see this in modern hypothesis. Now it has come up that there is a thing called clinical endocannabinoid deficiency syndrome (CEDC), where we say that certain people would be suffering from certain diseases specifically because they have an endocannabinoid deficiency. When a body is not able to kind of create these endocannabinoids, we have to rely on external sources. Anandamide being one of those endocannabinoids, and we have the ability to kind of get this nutrition from outside as well. So definitely to maintain homeostasis, for effect, the right dose can also assist in getting the right kind of sleep as well. So we see a lot of those benefits. There are clinical studies that we can kind of put together to see this benefit as well. But the right dosage there is very important because we do not want to have get somebody with a higher dose on a regular basis. We can move on.
Yeah, I think also even from a mood and a wellness point, I think it's important to understand that these phytocannabinoids, CBD and THC, interact with our CB1 receptors as exogenous ligands. So because of there are exogenous ligands like anandamide, which is a very common one that binds to the CB1 receptor and gives you sort of feeling and sort of alleviates the feeling of anxiety, depression, etc. But the time span is short lived. So that is where it's important to optimize from a dosing point of view, optimized from at what interval this must be consumed, where a dose tolerance is not built over a course of time. And there's ample scientific literature and information globally in terms of how even CBD is working in terms of breakdown of the endogenous anandamide and how it sort of is being inhibiting the anandamide degrading enzymes.
Right, great. So I think we have the last question here, and then we are proceeding for the conclusion. We have another session on Clubhouse at 8 o'clock. So if all of you are there on Clubhouse, please join us. We have the CBD Vaidya's club there. More than 1,000 members are there. So we will be discussing certain aspects today at 8 o'clock there as well. The last question is from where I can learn about plantation extraction process for active medical ingredients and formulation of Vijaya-based medicine, Mr. Bhatia. So I think there are so many aspects which you have mentioned, and it will take several years to learn all
Separate
of this.
session, separate session to discuss that. Yeah.
No, in fact, not separate session. I'm saying it will take you several years also to invest for, because this is so huge and vast as far as this knowledge is concerned. I think Boeco from last around 8 years now, they are into this, and still we all are learning. I am practicing actively from last few years now. But yes,
Yeah.
excellent question. You want details? You can connect. All of us are there on LinkedIn. We have tagged Jahan and Amnish today in the post. Also, you can just check my profile. The post is there, so you can connect with any one of us on LinkedIn, and we will be happy to help you in any aspect which we can. So again, thanks Avnish, thanks Jahan for this wonderful session. I think it was very well described as far as all the aspects are concerned. I can see so many doctors are still with us in this session, and we have a very good attendance today, participation and engagement, and it's very encouraging and motivating for us as well. So thank you again to all the doctors, all the people who have joined us for this session today. Please spread this information to across all your network. This session will be remaining on our all the social media platforms. You can share the link with your senior, juniors, and your in your network as well, so that it will help and go to all the people. And the only aim and the only idea is the people should get relief in their pain, because as a clinician I really feel bad when people are suffering from the pain and they are not able to heal that. And today, as we have discussed about the pain management, please share this with all your family, friends, relatives who are suffering from the pain, because this is one of the excellent solution which they can have in their life, and they can get away from all the harmful side effects. So thank you
Yeah.
again, Jahan and Amnish and Bombay Ham Company, for ensuring these kind of sessions are happening and will be happening in future as well. We are very much pleased to have you with us. And on that note, I will be concluding this session, and we will be coming up on regular basis now. So please watch us our space, and we will have many more sessions in future with Bohec. Thank you.
Thank you, sir. Thank you.
Thank you, everyone. Thank you.